Record management is an ongoing and ever-growing task in many organizations, especially those in the medical field. This is true in the case of Pioneer Manor, a long-term care facility in Sudbury, Ontario. With their medical records already being managed by an electronic system, our group was tasked with assessing the options available to Pioneer Manor for the purposes of managing their non-medical care records for each resident. We will begin by covering background information of the client, their problem, and their objectives. Next, we will look at how the current system in use by the general practitioners functions, and how our proposed solution for personal support workers will operate in parallel. We will then transition into how we plan on taking this idea from the page into reality, including things such as budget, training, failure response protocols, and other important considerations. Lastly, we will conclude our findings. The Greater Sudbury area is a large geographic region located 400 kilometers north of Toronto. Pioneer Manor is a long-term healthcare facility managed by the City of Sudbury. It is the largest facility of its kind in northern Ontario, providing 24-hour supervision to its 400-plus residents. The facility serves residents 18 years of age and older who have long-term healthcare needs and who are no longer able to manage in independent living situations. In October 2009, the Office of the Auditor General of Ontario, part of the Government of Ontario, published a special report pertaining to their Electronic Health Records Initiative, known as EHR. The federal and provincial governments agreed to develop EHR in September of 2000 and began planning the system in the late 1990s. After copious amounts of research, auditing, and testing, the government published this mandate setting goals that extend a decade after publication. Healthcare facilities were tasked with incrementally implementing the mandated objectives over a specified time period. Systems governed by the EHR are now required to meet the following 4 criteria. The system must have a secure network on which patient data can travel, applications that enable users to record, store, and retrieve patient data, all patient data such as treatment history, test results, diagnostic images, and prescribed medications in digital form, terminals or access points from which users such as doctors, support workers, and clinics can input and retrieve patient data. The primary objective of this project is to replace the traditional mechanisms of paper record keeping with an electronic system that can be used by the non-medical staff to record non-medical data. This project will eliminate issues in the record-making process at Pioneer Manor by providing a simple, robust, and secure solution for personal support workers. This will in turn allow non-medical staff to focus their time and efforts on providing comprehensive, individualized, and responsive care. The client has prepared a proposal for the executives of the facility. Our project team was given a detailed list of questions to be answered with justified responses to accompany the suggested solution. The purpose of our proposal is to provide a comparison to their existing proposal, providing alternatives and options that can be implemented either in full or in part to create a better solution for the facility. The electronic medical record software currently in use at Pioneer Manor is PointClick Care, a web-based software utility used by nurses and doctors to track the medical care given to residents. The information from the software is managed using vendor servers with no local server present on site. The software must be connected to the internet to access the server information. There are 90 wireless access points on site that are used by devices to access the internet. For non-medical care purposes, records remain paper-based, with personal support workers completing a daily care flow sheet, which is attached to resident files. Currently, there are 45 Toughbook laptop computers attached to carts for use by medical personnel. To better serve residents effectively, Pioneer Manor is looking to add an additional 60 units for personal support workers. The implementation of PointClick Care for medical purposes was a typical IT project. The city required vendors to bid and demonstrate systems based on specific criteria and solution requirements. Installation occurred in parallel, meaning that as the vendor was configuring the mobile systems, the wireless infrastructure was being installed. This resulted in the end users having limited to no input in the process, with the exception of a 6-month fine-tuning process after installation. Initially, data transfers were slow because of multiple ISP layers. Users also complained about lengthy wait times between loading pages on the software, a major barrier to completing work efficiently. These problems were rectified by caching the website, thus reducing the content loading time. 2 candidate software solutions were investigated to be used by personal support workers at Pioneer Manor. These included Allora Home Health and Access Care. Allora's web-based home care software solution and its point-of-care features can be accessed using an iPad, iPhone, Mac, Android device, Windows-based desktop, laptop, and tablet. The software supports comprehensive care assessments, patient and employee profiles, shift scheduling, paperless records, visit notes, and human resources functionalities such as billing and payroll. The costs associated with this software includes a one-time installation fee of $1,775 and a monthly usage fee of $425. Allora Home Health was eliminated because it does not support customizable assessments, which is essential for the paperless nature of this project. Access Care is a web-based solution developed by a company specializing in home care management software. The software has an intuitive user interface and works on all web browsers including Android, iOS, Mac, Windows Desktop, and tablet browsers. The software includes functionality for care assessments, an unlimited number of users, patient and caregiver profiles, billing, and scheduling. The software vendor also provides free training through YouTube videos to overcome learning curves. Access Care lacks certain features that are essential in the proposed solution. It does not have support for importing paper records, offline availability, or customizable assessments. PointClick Care is a cloud-based software system and is supported on all popular web browsers, including Mac, Windows, smartphones, and tablet browsers. The software has a simple and easy-to-use interface. It also supports customizable care assessments, so the workflow can easily be transitioned from paper to electronic-based. Since it is already used for medical care records, integrating non-medical care records would lead to a single consistent repository of resident information. This would assist the facility to manage resident health with full functionality, allowing the doctors and nurses to utilize non-medical data and consolidate the resident information across multiple levels of care. After researching the potential software solutions and comparing them against PointClick Care, PointClick Care seemed to perform better than all the other software in terms of functionality, usability, support, and extensibility. The main concern with the current hardware is that Toughbooks are unnecessarily rugged for this application. Toughbooks are more expensive than normal laptops because of their ability to withstand extreme climates. However, as Pioneer Manor has no extreme climate or adverse conditions, the next 60 laptops purchased do not need to be Toughbooks. The only requirement for Pioneer Manor specified with regard to the hardware was for it to include Wi-Fi connectivity and the capacity to operate the software. PointClick Care recommends using a laptop that includes a 1.6 GHz processor, 2 GB of RAM, 16 GB solid-state hard drive, and Windows 7 installed. Laptops with such specifications can be purchased for roughly $400 from average retail stores. PointClick Care also recommends setting up a server for local backup of all recorded information in the rare cases of data damage or loss. Because the amount of data that requires backup cannot be appropriately assessed given the current information about the project, our team strongly encourages obtaining the advice of an IT specialist to determine a server size that will sufficiently hold all of the data. IT project implementation often revolves around software and hardware considerations. However, the success of an IT project also depends on the team's willingness to focus on the end users. For example, during the planning phase, the project team should gather feedback from end users to ensure that the solution is tailored to their needs. Directors of Pioneer Manor and the IT department should understand that this is a period of intense transition for staff, with the potential to create fatigue, confusion, and feelings of personal failure among employees. Based on the physical design of the facility, it would be possible to allocate phase implementation to each floor and wing of the facility. Phasing the implementation can help identify potential problems on a smaller scale and aid the transition for other PSWs. Upon completion of the implementation phases, fine-tuning can be made before the go-live date to further optimize the solution. The implementation of the hardware will consist of several tasks. Hardware and support infrastructure, including laptops, new carts, servers, and printers, must be selected and procured. Mid-range laptops should be acceptable to complete the required functions of digitizing and recording non-medical information. Servers may be required for backing up information, and additional printers may be needed. The second step in the hardware implementation procedure is the removal of obsolete equipment. For example, the many cabinets needed for storage of paper records. As PointClick Care is an existing solution in the facility, limited resources will be required to configure the PSW requirements. PointClick Care offers configuration assistance as part of the subscription, meaning that required changes are already factored into the cost of the subscription. The cloud-based nature of the system limits the effort that will be needed on-site to simple software installation. To meet the requirement, all paper-based records from the last 2 years will be converted to digital to be integrated into the new system. This task can be outsourced to third-party firms that specialize in this type of document processing. This was the method of choice for the transition of medical records during Phase 1 of the EHR initiative. PointClick Care offers a subscription-based support system. This appears to be the best solution for on-site training as well as ongoing support. Prior to rollout, the staff will be able to participate in online and in-person training to become familiar with how the system will operate. The new system must provide access to the previous 2 years' records for all personal support worker interactions with all residents. This large volume of information poses a significant challenge to a cloud-based solution such as PointClick Care. PointClick Care is available in a tiered structure with varying functionality based on the subscription. Pioneer Manor is a top-tier subscriber with full access to all features. This allows the use of attachments in resident profiles. The limiting factor is the size of the attachments as well as the total combined size of all attachments. With this limitation, direct storage of scanned records in resident profiles is not feasible. Alternatively, scanned records can be loaded onto an FTP server and direct links to the images can be stored in resident profiles. This offers the most scalable option while maintaining the security of the PointClick Care interface and has the added bonus of not impacting traffic volume on the external network, which would slow down the system. The primary operational consideration during the implementation phase is the training provided to PSWs. Trainers should be highly skilled users of the software being implemented and should fully understand the rationale for making these changes to the PSW workflows. The benefits of new hardware and software implementations should be emphasized to help foster interest and enthusiasm for learning and using the new system. Training sessions should be segmented based on major concept areas to provide a more manageable learning experience. For example, PSWs can be assigned into 2 training sessions, focusing on hardware and software respectively. To ensure a low trainer-to-participant ratio, it is suggested that no more than 15 PSWs be invited to each session. Once a group of PSWs have undergone training, they can then assist in the knowledge transfer to other PSWs who have not yet been trained. To further facilitate this process, a training manual documenting best practices and proper use of the system should be made available as a reference for existing and new employees. To ensure that the system is robust, modes of failure must be anticipated and mitigated. The first level of failure will be the breakdown or malfunction of an individual unit. A small number of backup units, 1 or 2, may be required to allow for reactive maintenance. Having an inventory of backup units also allows for proactive maintenance to accommodate work such as software updates, further justifying the cost. As PointClick Care is a web-based application with remote server locations, it is at risk of being unusable in the event of a site-wide internet outage. A local server to augment the cloud-based operation of PointClick Care would mitigate this concern. Based on feedback from the medical usage of PointClick Care, this type of server is not compliant with government-approved requirements of universally remote storage and operation. To prevent loss of connectivity, the facility's internet connection has already been replicated in triplicate to accommodate the medical record access, thus also covering the requirements for the support records. The final level of failure is at the vendor end of PointClick Care. If the remote server fails, there will be limited recourse for the IT staff at Pioneer Manor. Redundancy plans on the part of the vendor protect against this possibility with a minimum service level agreement. Again, a local server to function as a backup would protect against this concern. The management team within the City of Greater Sudbury will be responsible for the approval and execution of the budget. Hardware costs include the purchasing of 60 mid-range laptops, carts, servers, and printers. The cost of 10 carts is included in the budget based on the assumption that existing carts can be refurbished. As Pioneer Manor already utilizes PointClickCare, there are no foreseeable software expenditures for installation and usage fees. Operational costs include costs required to install the software on the new laptops. A breakdown is shown in the table below. The timeline for implementing PointClickCare into Pioneer Manor for the personal support workers is as follows. There is a buffer located in the third week of August for any executive delays prior to hardware procurement. A total of 4 training sessions, all held within the month of September, will be held for 60 PSWs. The training sessions are split up into 2 sessions. Session 1 will consist of hardware training. Session 2 will consist of software. During the first 3 weeks of October, old hardware will be disposed of, and new hardware as well as software installed. The IT staff and technicians are then scheduled to test, validate, and verify that the hardware and software installations are running as required. In November, the PSWs will begin using the new system and will provide feedback to identify issues. IT staff will be tasked with making modifications based on the feedback received, creating an improvement cycle throughout the second week of November. The last 2 weeks of November are slotted as a buffer period should training take longer than expected or if unforeseen issues arise. After evaluating the options, we concluded that an extension of PointClickCare was the optimal choice, as it fulfilled all of the client requirements and was the most economical and effective to implement. For hardware, we agreed that Toughbooks were not an optimal solution for the type of work that would be done on the laptops. We suggested a less expensive alternative from a lower-end consumer tier of laptop. To ensure traceability of old data, a digital archive is to be generated to host the previous 2 years' data. It is also our recommendation that a local server be implemented to function as a redundant backup. The success of this proposal will come through adequate training to familiarize all staff with changes. These changes will be monitored during the first 6 months of live system use. Further process refinements can be made using an iterative approach to incorporate feedback from users and other forms of lessons learned information.